Hello everyone. So when looking at knee pain, one thing I love to do and assess with people is side-to-side discrepancies or any kind of strength or movement deficits from the left to the right side. Now, while we can do a bunch of special tests and kind of assess each joint, what I want them to do, especially if they're just walking up to me and go, Alex, I have knee pain, what can I do? First off, you need a general assessment. You need to see, what primarily is being affected, what movements are provoking the symptoms to become worse. But one exercise or one kind of movement pattern I love to make them do is, especially if they can stand up comfortably to a point, is just have them, if you see, I'll back up a little bit, just have them kind of stand, in a movement where we're going to be shifting slowly from one to side with some thoracic rotation. Now, right now, I'm working in the frontal plane. So, once they have no pain here, or if they are positive for pain, we can move on and work through the sagittal plane. I'm going to have them kind of shift through the back heel onto the front toes, and as soon as that's over, I'm going to then work into the transverse plane, which is obviously rotation. What we can do is kind of have them move a diagonal pattern to see where we're going to start with exercises. And once again, this comes after a general full assessment, but when we're actually helping them get back to daily activities or moving in general, we want to see in what planes of motion especially, or combining different planes of motion, what can they do and what they cannot do. This will allow you to give them a general basis of different principles and to guide them through different workouts, whether you need to start in machines or whether your best course of action is going to be in a free weight/freestanding environment where gravity is your primary antagonist. So that being said, obviously these exercises come at a certain time and a special place, and that's your job as a trainer or clinician to kind of assess them. But when I have people who are in decent shape who just have kind of nagging injuries, I just want to see how they can shift their center of mass from their center of gravity, and I will kind of go from there and build a plan off of that and other assessments. So my 2 cents on that, very quickly and straightforward. Any questions, please message me.